you. So I will want that it is an interactive session. We will start, but anybody from you is welcome to stop the speaker at any point of time. I now firmly believe, sitting here in the DHS office and as Director MHM, that we must have in Punjab a Sarbat Khalsa concept, meaning thereby that we take input from everybody. There should not be any unilateral decisions or communications being thrown at the districts without taking into account any opinion of anybody. Please, anyone who wants to say something can say at any point of time, because maternal death is an issue. And along with maternal death, what we have been pointed out by Government of India, where we are lacking is family planning program, because we have a very, that is not a problem. Our growth rate is fine, our TFR is fine, much less than the national average. But our spacing methods are not in place. We don't have contraceptives in place at our various levels, starting from sub-center to the district hospital. And because that also lack of contraception and availability of contraception is lacking, because contraceptive failure is another reason of a very high maternal death rate in Punjab. So that also we have to take into account, and that has to come from you. Nothing can come from there. We can just show you the figures. Rest, the suggestions, the way forward has to come from you. Please, I request all of you, if you feel sleepy, if you feel that it is enough, you can't sit now, you please, you are free to go out and then come back when you feel like. I request you that please participate 100%, because without your input, nothing can happen. We have seen it, nothing has happened. So please.
Thank you so much, ma'am. It is really, ma'am, and related to abortion, we have 2 deaths. The data will be presented soon in the presentation. Ma'am, please proceed. Deliberations that only review will not suffice. We will have to have surveillance of each and every maternal death, and response has to be created. So in 2007 and 8, the guidelines were changed, and it changed from MDR to MD-SR, that is maternal death surveillance and response. So this is the map of Punjab, and not many districts are in green. Green are less than 113, which is an SRS ratio that has come up 114. And this is the struggle of Punjab through over the years. In 16 and 17, we had reported 590 maternal deaths, but our SRS was showing our MMR to be 122, whereas the actual state MMR was 155. Then in 17-18, the reporting was robust. Reporting further increased to 593, and we were facing 159 maternal deaths as per our state ratio, but our SRS showed us at 129. And in 18-19 again, then there was some sort of, I think some sort of mechanism was developed. We were sending the emails to send all the formats, and reviewing started happening at a very frequent and quarterly basis. So with the districts to send us the reports timely, to send us the reviews timely, which we are not getting despite the reminders, despite the phone calls, despite putting on the group. So request is to send so that we can do a quarterly review also. So this is the trend of MMR Punjab versus India from 2010-12 to 11-13. In 2010 to 12, India stood at 178, whereas in Punjab we were at 155. Then in 11 to 13, it was India stood at 167 when Punjab was at 141. In 14 and 16, the gap started decreasing. It was 130 for India, and for Punjab it was 122. In 15 and 17 data, we were at par, but in 16 and 18 there was a sudden spurt. It was 129. And after that, this is the latest data, that is 217 to 19, where we have declined by 14 points, but still that decline is not sufficient. We are lagging. We are behind India. So this is figures are for us to see, and this is our performance that is being reflected. So each maternal death leaves a clue. So we need to identify, review and take actions to correct the causes and determinants of maternal deaths to prevent the future deaths. So identification, early response within 24 hours, each and every maternal death has to be reported at the state level. We have already created one MDR reporting group. So I am happy that all the medical colleges are reporting within 24 hours the maternal deaths, because it is a facility-based death on that portal. But as for concern from the districts, we are not getting any 24 hours. Within 24 hours, we are not getting any reports of maternal death. That means that system has to be integrated down till the ASHA level. It is not that ASHA should know that she is getting 1,000 rupees incentive for reporting of the maternal death within 24 hours. 40 MMR. It has risen to 153 and this year it is 174.
अमृतसर वाले कुछ
अमृतसर
दर्शन जी कोई की कहना चाहोगे डीएफपी
And review and reporting is not coming. मैं मेरे साथ
सोचिए डॉक्टर की प्रॉब्लम आप उनको
we are trying our best to
नहीं डॉक्टर सुनो मेरी बात डीपीएम अमृतसर was on leave and she has come back. She is also, I know what kind of work she is doing. I know about this. So the DPM अमृतसर cannot change your maternal mortality rate.
सब तरह से उनको समझा रहे हैं जी, प्यार से मीटिंग
नहीं डॉक्टर साहब सुनो मेरी बात, मैं सच्चाई बता रही हूँ कि ये संगरूर वाले वाउच फॉर मी. I went to Sangrur last Saturday. ते ਅਸੀਂ मतलब संगरूर is a very good district. I'm not pinpointing कि मैं ਤੁਹਾਨੂੰ ਕਹਿ ਰਹੀ ਹਾਂ, मैं ਅਸੀਂ health wellness center, because we created a team from health wellness center is sitting here and they should also take note. When we have told the CHO, the community health officer, to report all high risk pregnancies and make a record of high risk pregnancy, and they should consult the hub gynecologist regarding high risk pregnancy. When we saw it, we went to two health wellness centers. So ek mein there was a register's name written, nothing. I mean, I called the 7.6 HB. How many of our people in the staff, and I'm not like how many of us know what is the protocol for anemia? The staff there, the entire staff was not aware that you are saying that HB 7.6. They had written some phone number also. I called on that phone number and they are saying, the family said that we never went to this health wellness center, we don't know. We go to the other hospital. So this kind of a record which is fake and which is poor. At the other health wellness center, there is never any identification of high risk pregnancy. I have reviewed each and every district and block as director NHM because I get the data. HMIS data. Sit down, ma'am.
सारे SMO सारे LHPs ਨੂੰ high risk ਦੀ list ਬਣਾ ਲਈ ਉਹਨਾਂ
अच्छा डॉक्टर एक मोटी जी गल ही नहीं किसी को पता लगती कि हाई रिस्क प्रेगनेंसी आज आ गई, whether it was her 3rd month or 4th month, till such time that she is delivered, she is to be reflected as a high risk pregnancy. Say a person had high BP at one point of time and you said that this month she is high risk, and next month you recorded her BP and it came out to be fine, but she should continue to be in the list of high risk pregnancy of that institution till such time that she delivers safely. Her outcome should also be reflected in the record which they are having in their hands, and I must say it is all fake, poor in quality record. Kindly check those records. Those records are, I mean, check that most of the high risk pregnancies identified are on the basis of history, previous cesarean, previous abortion, 4th child, or small height or whatever, which is just you don't have to take BP or HD, measure HD of the person to declare her high risk. So no other follow-up, and anemia follow-up is a must. Once detected with anemia, a high risk person, and I will say this that and record records are also very poor. We are doing work like when I joined as director, I knew that every day in District Hospital Mohali, IV iron was being given to people, to so many people that we had created a ward. Dr. Pagat will vouch for it. To give IV iron, we had put a staff nurse there on duty. When the record came from District Hospital Mohali, hardly any HRP with anemia was reflecting in HMIS. How come this was? This is because the records are also, I mean, it comes being compiled. I'm not saying it is Mohali's fault, it is everywhere. We are doing the work. First, our work is shoddy. Then our record keeping at the base level is shoddy. Then the record which is sent to the state is totally haywire. So the whole thing is not working. So I request Amritsar that to say that BPM Amritsar is going to change the scene is totally not true. Kindly look into it. Amritsar is a very important district. I welcome our MD MHM, Shri Tej Pratap Singh Phulka ISG, and he's our mission director. I welcome you, sir. And I welcome Dr. G.P. Singh, Director Health Services Punjab. And sir, today we have representatives, senior officers from all the districts and national observers and our international partners here. We are basically reviewing the maternal death scenario in Punjab, and I will request Dr. Inderdeep to just show 2 slides to sir, where you are talking about our rising MMR as compared to the national level, and also the districts where the map of the districts where we have a problem.
Good morning, sir. So this is the past trend of MMR in Punjab versus India. When the MDR reviews started in 2010. So in 2010 to 12, sir, India had an MMR of 170, whereas Punjab was at 152. So it is all SRS data. And in 2015-17, Punjab was at par with India. And then there was a sudden rise in the MMR in 2016 and 18, whereas India fell to 113. Punjab's MMR increased to 129.
You kindly explain the maternal
To delivery and childbirth within 42 days of pregnancy, and it is the number of women per lakh live births. The women who are dying per lakh live births is the maternal mortality rate. So, because it's sort of a blot, because all the health indicators are doing very good except for the MMR. Then further, sir, this is the last 3 years data comparison of the districts in the state. Sir, many districts where MMR has increased, like first is
as well as in Sangrur or wherever I am being posted, the review, most of the deaths, they were preventable, and that is the saddest part. We could have saved the mother. Actually, it is not the mother going, it is the whole family which is just uprooted with one death. And the thing is, doing that MDSR, that maternal death surveillance and response, that we have changed the name from review, is not to, like, it's not a to pinpoint any of the faults or at any level, but they are to like, we are doing our own audit that what could have been done to prevent this particular death, and we have to learn from that particular death that what we are doing will be doing in future and what we are will be not doing in future. Like as madam said, a very serious problem we are facing is anemia. And anemia is one thing which is done by a very simple test. And when you detect anemia, that is HB, like ma'am said, HB 7.6, a red flag should be on that card. I don't think that would cost much. It's not, I know, I have worked in district hospitals for so many years, that same gynecologist is not sitting, same FMO is not sitting all the time. So when the red flag on that particular prescription is there, so anyone who sees it knows that it is a high risk pregnancy. So that is not a very big thing. To you detect the HB, it is 7.5. You put a red flag on it, like ma'am very like she said, ki once the BP is normal high, If you put a red flag, next time maybe she is on antihypertensive, किसी ने 2 गोलियां पिंडों खुआ दिया, कुछ करता, next time वो जब BP normal आ जाएगा, doesn't rule out that she is not a high risk pregnancy anymore. So a simple thing like just putting a green flag when it is a low risk and a red flag when it is a high risk, I think that can be a little thing that we can do, so that anybody who sees can make out. The house is open. The house is open to interaction. May I allow that?
Yes, please.
Right, please.
सर, जो मेरे विचार से जो मैक्सिमम कॉज है 2 फैक्टर ही हैं, जो ब्लड प्रेशर है और एचबी है. बाकी जो दूसरे कॉजेज हैं जैसे सीपीडी है या और फैक्टर्स हैं वो इतने ज़्यादा नहीं इसमें रोल प्ले करते. मैक्सिमम हम एनीमिया को कवर करते हैं तो मैक्सिमम हमारी डेथ प्रिवेंट हो सकती है, क्योंकि बर्थ स्पेसिंग है, एनीमिया है एंड बीपी. Only 3 factors we have to focus on these factors.
If we just check the
HB, yes.
just check the
BP, yes. We can prevent the maximum
The
deaths.
maximum deaths can
Yes.
be prevented by just these 2 simple things.
Yeah, other causes है, 18 causes are there, जैसे CPD है, when previous abortions हैं, they are not high risk.
If you
It
talk
means,
to your patient for 5 minutes,
Yes.
Asha will get to know the previous
Yes,
history.
yes.
She's going to tell you. If you just see her abdomen, you will get to know she's a previous pregnant. But you have to really touch the patient and
yes,
go to the
definitely,
patient
definitely.
and just have talk to her for 5 minutes, and you will get to know the majority of the high risk factors. Seeing a short stature coming into her OPD can make it. You can make it out. She's a case of epithelial disproportion. So उसको high risk में डालो, उसको institution.
Sir, I would like to apprise you that from Ministry, Government of India, we have our Senior Technical Advisor, Dr. Tushar Purohit, and from Maternal Health Division, Senior Maternal Consultant, Dr. Rashmi has also come. Along with, we have a support from some WAKE project, which is a project by USAID's RISE project. And sir, we are supporting our 2 aspirational districts at Moga and Firozpur. So support from Ministry is there, sir. And we will be launching a new MP portal, sir. That portal is that wherever the maternal death is occurring, that block has been already mapped. That SMOs, IDs and user IDs and passwords have been generated. And then sir, how to use, because it is both at the facility level as well as at the block level, sir. So where whatever block the death will happen, it has to be entered on the portal and it will be reflected pan-India, sir. So this portal will be starting after this training, sir. And Punjab was the first state to start a pilot in both maternal and child health, this MPCDSF portal, and then it was implemented pan-India, sir. So after the training from the experts, we will go further in the portal modes.
our
would like to thank Punjab State, MD sir, Director Health Services, Family Welfare, Director Health Services and ESI, Principal cum Director Ma'am, SIHFW, and Additional Director Ma'am Indradeep Ma'am to organize such a wonderful event. It will be very useful. Why it is useful actually? It is useful because we have seen, as sir was mentioned, last to last SRS survey, we have seen our MMR increased by 5 points. So as sir was saying that it was eye-opener, but in last SRS survey we have seen the declinement of 15 points. So I would like to congratulate all of you because it is only because of your efforts. So things are not very bad, but the theme of concern is that still we are having our MMR more than 100. So there are few states in India where MMR is more than 100. Punjab is one of them. So all things which we are doing in this workshop, whatever it is MPCD, SR or EPMSMA or Suman activities, these activities will help you to further decline your MMR. So I think you should keep concentrated on this workshop and it will be helpful to you. Thank you very much.
Now I will request our respected MD sir to say a few words to guide us towards a better Punjab. I would say when we are able to save our daughters, that would be a thing which we are aiming at. I request our Vardi MD Shri Tej Pratap Singh Phulka, I.ਏ.ਐਸ sir, to say a few words.
Good morning to all doctors. Dr. G.V. Singh, Director Health Services Punjab, Dr. Reed, Director family welfare, and all respected doctors, even doctors here from Delhi and other places. I think this issue is extremely vital for the entire country and as well as the state. I would say it's a very, very sensitive issue at the same time. Because if we examine, if we feel the plight of, the people who have gone through, let's say a child, I relate a personal incident. I had a boy who used to work for me. He was from Bihar. So he was very happy that, his wife is going to deliver a baby, and he took leave and had gone for a few days. And then I got a call that on the day of delivery, the wife sort of passed away, and the child was alive. So, a child coming to this world without a mother, it's very, very, really heartening. So that incident, when Madam told me about this, that we are having this, I said this is really, really vital. Because when people go through this personally, there could be so many children who were born without mothers. You can imagine the plight of the child. He has to live with either his uncle, aunt, or maybe his grandmother. And other than that, when the lady is gone, the entire household is disappeared. The husband is, he's like widowed. Then the parents are left without, where they are looking forward that, there's going to be happiness coming in the family. Suddenly everything goes upside down. So, like the doctor just mentioned, that they could have been prevented. The deaths could have been prevented. But why, due to some laxity or due to some, careless attitude, things are happening like this. I think if we motivate our ASHA workers, you're all senior people here, just have, sensitize them regarding this topic, talk to them frequently, and make, some standard operating procedures. Like it was mentioned that, check the hemoglobin. If the hemoglobin is down, just flag it. Other than that, their nutrition, whether they're getting proper nutrition at the right time, whether somebody is monitoring their health, and all those parameters which you are all well acquainted with, which can be done. But it needs to be looked into seriously. Every child, every death should be a matter of concern. Like here, when we talk about these figures, that 114, 103, and even if there's an accident, it's simply we read in the paper that 40 people have died or 30, but it's, these are just figures for us. But for the people who are affected with those figures, like those 40 families, or just imagine their plight. So I think it is just a matter of being a little more sensitive and just more dedication, and surely we can bring Punjab much below 100. We have excellent facilities in Punjab. All the doctors are in fact very, very dedicated. And if you have any problem, Secretary Health is very, very positive. He said that any kind of help, any doctor, you kindly send it to us in writing, send it to me directly, send it to the director. We will take sure that we meet your needs. But there should be no reason that we didn't have this such and such facility, or for this reason we can't do that. Let us know what you require, but from your end we require that you put in your best effort, and even the staff below, just motivate them and tell them what is to be done. So with these words, I thank all of you for coming here and attending this workshop.